Mayor Stanton, Representative Olson, thanks so much, both of you, for being here. I'm just going to take a second. I don't live in Phoenix, I live in Anthem, but half of the people in my town of Anthem do live in Phoenix, and I'll just take a second to lobby our good mayor, as I had his predecessor, to why don't you annex the other part of Anthem that I live in, and then I would have a good mayor rather than living in unincorporated Maricopa. Just keep that thought in mind, Mayor Sam. We talk so much about Social Security, Medicare, and Medicaid. I'll just give you a few statistics as it relates to folks that live in the state of Arizona. This is how Social Security works for the residents of Arizona and the economy. Social Security provides benefits to over 1 million Arizonans in 2010. 1 out of 6 residents, including 724,000 plus retired workers, 144,000 plus disabled workers, 76,000 widows or widowers, 45,000 plus spouses, and 76,000 plus children. Social Security provided benefits totaling over $14 billion in 2010, an account equivalent to 5.7% of the state's GDP, and that is the total value of goods and services produced. The average Social Security benefit in 2010 was $13,232. Social Security in 2010 lifted 337,000 Arizona residents out of poverty. Social Security works for Arizona women. They provided benefits to over 538,000 Arizona women residents in 2010, 1 out of 6. Without Social Security, the poverty rate of elderly women would increase from 10% to 43.1%. Social Security works for Arizona's people of color. Social Security provided benefits to over 32,000 African Americans in Arizona in 2009, 1 out of 10 African American residents. It provided benefits to 1 of 6 Latino households in 2010, over 76,000 households. Now let's talk about Medicare briefly. Medicare works for Arizona residents and the economy in that over 883,000 Arizonans received Medicare benefits in 2009, 1 out of 7. Medicare provided over $8 billion in benefits in 2009, 23.6% of all health care spending in the state. The average Medicare benefit was $9,567. Medicare works for Arizona's seniors and people with disabilities. 755,000 plus of Arizona's 883,000 Medicare beneficiaries were aged 65 and older in 2009, nearly 9 of 10 beneficiaries. 134,000 plus of Arizona's 883,000 plus Medicare beneficiaries were people with disabilities in 2009, 1 out of 7 beneficiaries. Medicare also works for Arizona residents in the economy. 1,700,000 plus Arizonans received Medicaid benefits in fiscal year 2009, 1 out of 4. Just think about that. A total of $8.7 billion in Medicaid benefits was paid in fiscal year 2009, 24.2% of health care spending in the state. The average Medicaid benefit is over $5,000. Medicaid works for Arizona's seniors, people with disabilities, and long-term care residents. 103,000 plus residents of Arizona and 1,700,000 Medicaid and Medicaid beneficiaries were aged 65 and older in 2009, 1 out of 16 beneficiaries. 150,000 plus of 1,700,000 Medicaid beneficiaries were people with disabilities in 2009, 1 out of 11 beneficiaries. Medicaid provided $1.9 billion in long-term care benefits for Arizona residents in 2009, including providing nursing home care for 7,490 nursing home residents. 2 out of 3 state residents enrolled in nursing homes. So those are the statistics, but every one of those statistics is a person. And I can tell you, I've been lucky throughout my working career, starting in I started before I graduated from high school in 1958, but that was only part-time. Every year that I worked full-time, until I retired in 2002, I had the luxury, and it was a luxury, of earning enough money that I paid into Social Security and Medicare when it became available. I paid the maximum amounts. So I don't think that that's an entitlement. It's something I paid into, and I deserve to get, as all of you have worked your working careers, are entitled to receive. As the mayor said, as representatives said, we must be vigilant.